Wonderful. Okay, so welcome everyone. I am super excited about our guest speaker today, Dr. Judith Blanc. I first came to know of Dr. Blanc when I was looking for different translations of the CD risk. I was like, oh my goodness, someone has actually translated the the resilience scale into Creole. And then since then, I've come to know of Dr. Judith's work and then got to meet her here at the University of Miami. So Dr. Blanc is a multilingual assistant professor with the Department of Psychiatry, and she has a lot of cool studies going on, including the Haitian Wellbeing Study. She's the founding director of the Holistic Family Study, which aims to leverage innovation, ethnography, and integrative medicine to study cumulative and intersectional stressors amongst marginalized families. She also takes an intergenerational approach to her work. And why we invited her for the series, our Charm Tech Talk series, is for some of the very innovative work that she's doing using technology. And on point with what we're looking for is a tech equity or health equity approach to technology as it's incorporated in mental health and well-being. So I'll leave it at that so we can get to hear Dr. Blanc's talk, and you can read more about her in the bio. Thank you, Dr. Blanc, and take it away.
Okay, I was muted. Oh, okay, thank you. Thank you, Lintita, and thank you to everyone for being here. As you can imagine, it's an honor for me to honor the invitation of Charm Core Tech Talks. And of course, I'm super excited to talk to you today about two I selected two because those two clinical trials, they are the most, heavy into technology, immersive technology. So I'll talk about the research that we are conducting in the area of virtual reality intervention. But before that, I will also introduce you to the digital health equity framework that me and my team, we have developed at the TSCS and published last year. So usually before I start my talk, I mean, because I never have any, conflict of interest to disclose. So best way for me to explain, to provide the context or the relationship that I have with my research question, my research interest is by, at least introducing you to a little bit of my personal story, my trajectory from Haiti to France and then to the United States. And I also would like you to be mindful of the fact that I'm a mom, right? So all the intersection of all these identities and my lived experiences and what I believe in, my vision of life of research, they shape my entire research program. And this is exactly what you will see today. Okay. In terms of takeaways from today's presentation, so at the end of the presentation, I hope that for some of you who are just who are student or seasoned researcher, I hope that you will gain a understanding or deeper understanding of why we need to address mental health equity and conduct research with and for diverse and underrepresented population. I also hope that you will gain insight of best methods and practices to address mental health care equity and conduct research in diverse population. And of course, I'm sure we won't have a lot of time to, to do to dive into an exhaustive list of those potential best methods and practices, but instead, I will take the time to talk about our work at TSCS, the Center for Translational Sleep and Circadian Sciences, and as well as the lab, the Holistic Families Lab that I'm building to implement my research program. Okay. And then at the end, I will do my best to, I prepared a lot of slides and we basically started a little bit late at so point three, my goal is to show how my team and we are advancing mental health care equity and research among women of color in South Florida through the Nurturing Mom study, as well as the Realist Women study, which is my key award that just got funded at NHLBI. And I usually end my talk with a call to action. Okay, now the problem the problem that our entire research program is trying to tackle per se. You will be shocked. For some of you, this could be very basic because we are doing HIV research, we are healthcare equity champion, clinician. So you may think that everybody is really aware. We all have a proper understanding of why this work is needed. But maybe 2 weeks ago, I was really shocked to when I was having a conversation with a friend who is also a researcher, but he doesn't have a background in clinical psychology as I have. And so we were talking about stress research. And at some point, he mentioned how a mentor, a basic scientist mentor, who also do those health disparity research, doesn't is not really interested in including and accounting for stress because everybody has stress. What's your take about that? Basic scientist, researcher, health disparity researcher doesn't believe that it's important to account for stress because everybody has stress. Any feedback on that? Yes.
Well, there's stress. Like, I'm so stressed out. My TV show isn't going to be tonight, and I want to make sure to get home for the Olympics. And then there's stress. Like, I don't have housing, and I'm, experiencing depression. And plus,
Yes.
I experience violence, and I'm not sure where my next meal is coming from. And I had a trauma history.
Absolutely. So I think I don't have to, to continue with the slide deck anymore because that's exactly the goal, all the argument, the rationale behind our research, my own research program. It's the fact that although we all have stress, we are all exposed to stress. It's a normal part of life. But unfortunately, for social reason, for historical reason, political reason, we are not experiencing the same level of stress. Cumulative, there's a cumulative stress, intersectional stress that we are not all equal to when it comes to those, the social determinant, right? So that's why I'm like, oh, okay, I'm so happy I have this talk that is coming. So that will be a great occasion for me to go back to those basic because not everyone really understand why it's important to account for stress. Okay. So maybe I don't even have to go, to specify, or we have overwhelming evidence showing that, okay, visualization, the ordering process, right? Determine our social environment, our social experiences at different stages of our life, which affect our gene function. Thereby, this could influence our trajectory, health trajectory, and modify disease risk factor. So I believe that maybe in the mind of these basic scientists, we research, this overwhelming research, it's about physical health only. That is not true at all, because those social determinant of health factors, actually, they are stress, right? And we are not equal when it comes to, how we are affected by those social determinant of health stresses. And when it comes to mental health, it's, it's as urgent for us, as researchers, healthcare equity, health authority, to contribute, to advocate, right, for mental health care equity, right, which would take into account a fair and just distribution of mental health services and resources, ensuring that all individuals have access to the care they need, regardless of their socioeconomic status, race, ethnicity, gender, geographic location, or other demographic factors. It's also encompass the principle of fairness, justice, and inclusivity in providing mental health care, and aims to eliminate disparity that exists in the accessibility, quality, and outcomes of mental health services. Okay, so one of the solutions that I'm proposing is the Holistic Families Lab research program. By applying innovative ethnographic tools to understand the unique stress responses among racial, ethnic, and disenfranchised families, I investigate challenging mental health issues by incorporating social determinant of health, enhancing our understanding, and enabling the creation of solutions that address this determinant, an area that requires further exploration. As you will see in the upcoming slide, I'm developing culturally tailored intervention, cost-effective mind-body intervention to improve the overall health of minoritized population. So here you have a list of initiative research studies that the Holistic Families Lab have ongoing in order to accomplish this mission. For example, I'm the principal investigator of the Realist Women Study, a new key award that I just obtained from the NHLBI, as well as the Haitian Wellbeing Study. I'm the co-principal investigator on InnovCare, which is an R01 grant that we are in the process of acquiring in partnership with InnovCare, which will focus on maternal mental health care, a digital intervention for maternal mental health. I'm also the co-investigator and faculty lead to on R01 that my mentor, Dr. Girardin Jean-Louis, is leading at TSCS. The essential focus on assessing social determinant of insufficient sleep among Black, as well as co-principal investigator on nurturing mom study, which will be I will dive in very deeply into the preliminary findings of that clinical trial in a few minutes. Okay, in terms of best method and practice to address mental health care equity and conduct research in diverse populations. So again, I think this will require an entire book, right? An entire talk in itself to dive into this. But instead, what I propose is to walk you through the idea of the TSCS Digital Health Equity Framework that me and my team at the Center for Translational Sleep and Circadian Sciences, we have developed and published last year. Okay, so in 2020, it was COVID. So do you remember, although so at that moment, we were a team of a health disparity, sleep health disparity group at NYU. We were not yet like a Center for Translational Sleep and Circadian Sciences at UM. And we were already conducting community participatory based research, always, out and about. Sunday, Saturday, I had a lot of fun. I was just a postdoc at that time. And those community-based event recruitment in Brooklyn was, usually were like an occasion for me to get to know the community and, being outdoor with my kid, I enjoy that. And COVID happened. So those settings, community-based settings, the church, the barber shop, the beauty salon that we love so much, right? To take over, to do sleep screening and also raise awareness about sleep health equity in Brooklyn. So it became no longer possible to do that. Therefore, our team, we had to become innovative. We had to innovate. We had to find a solution, right? Efficient solution in order to continue to go meet the population that we are serving where they are. And where is the best, what is the best place to meet them where they are than their house, right? So it was no longer the church. For a moment, we had to pause. Then, so we came up with a human-centric design and developing a remote health and sleep monitoring solution pivotal to TSCS research program. We introduced the TSCS digital health equity model, which present a strategic methodology for reducing health disparities through digital innovation. So we know through all, over the past decades, in partnership or under the supervision of my mentors at TSCS, such as Dr. Girardin Jean-Louis, as well as Azizi Seixas, we had gathered overwhelming evidence showing how intrapersonal barriers, individual barriers, interpersonal, community, and institutional factors consist like a major barrier to not only sleep health, mental health, cardiovascular health access, but as well as health services, intervention, information, education. So we came up with digital solutions, right? Such as developing digital health equity, digital health literacy curriculum for our participants. That means we are mindful of the fact that, okay, not everybody has the same access, or in order for us to implement, for them to be able to use those, latest digital gadgets to monitor sleep, cardiovascular health, or mental health, we are aware, we are mindful that we have to start with the literacy. So when our research staff go in the community, it's a moment for our research staff to do this digital health education, right? And we also leverage wearable devices to monitor sleep health, cardiovascular health, and mental health. We provide iPhone, iPad, and we leverage webcam, Zoom to collect our data. Those wearable devices that I just mentioned usually are enabled with Wi-Fi, blood pressure monitor, weight monitor, also enabled with Wi-Fi. And we also send home and participant home environmental exposure monitor, right? So our goal is really to capture multi-level determinants of sleep health, cardiovascular health. And now within my own lab, which is in development, my focus is on mental health because I have a clinical psychology background. Okay, so if by any chance you would like to know more about this project, about this framework, so you can scan the QR code and the article is available in open access for you to dive in.
And it actually works.
Yes, okay.
It's great.
Okay, I'm glad you got it. Okay, now let's talk about our inclusive research ceremony. So in the upcoming slides, I will talk about nurturing mom. And if we have enough time, I will introduce you to the study design behind the Realist Women Project. Okay, again, so this is a recent NIMHD blog post that I penned by invitation. So basically, most of the content I will be discussing in the upcoming slides, it was also discussed in that blog from NIMHD. If you want to learn more, you can also scan the QR code to get a sense of I mean, let's say the particularity of the blog post, it's the fact that I also, what I'm sharing in the blog post is how my personal story with trauma exposure during my postpartum period in Haiti, or as a Haiti 2010 earthquake survivor, inspired my motivation, my passion to leverage digital technology to help address intersectional stress among women of color, including mothers. Okay, so one of the reasons we are focusing on leveraging portable digital solution for culturally tailored intervention among women of color. It's because of the on-demand content, right? The dynamic, standardized, and embodied solutions those technology provide. Because most of the time, women of color, Black women, for example, they are experiencing psychosomatic stress. So we need psychosomatic stress, but at the same time, because of this intersectionality and social determinant of health that those people they are experiencing, we need to think in one solution, right? And in the portable digital solution. So we are trying to tackle several level of social determinants, such as the limited access to transportation, the limited access to healthcare coverage or mental health coverage, and also the embodiment of the intervention. So when it comes to virtual reality and in the field of perinatal mental health, so now more and more we have evidence showing that virtual reality with the computer simulation of experiences of pregnancy and postpartum, as well as the guided imagery breathing techniques, can provide a distraction from pain and environmental stress. And when it comes to our research program, so the third solution that we are proposing from a theoretical perspective is also to design those interventions from an intersectionality perspective, meaning we need to focus on unique challenges, focus on unique needs, and as well as ensuring that our research is inclusive. That means the participant that we are working with, their voice is really heard, and that they become a co-researcher in the study design, study implementation, and even study interpretation. Alrighty, okay. One of the most exciting and impactful projects within our lab, Nurturing Mom. Long title is the goal is to evaluate the effect of a virtual reality program on maternal stress among expectant and postpartum Black and Latina individuals in South Florida. So what we are trying to tackle here, I'm sure that you are now aware of the maternal mortality crisis that is affecting United States, one of the most powerful country in the world. But United States is struggling with a level of maternal mortality that, mimic low-income country. And sadly, as always, racial ethnic minority women, particularly Black women, they are the most affected by maternal mortality crisis. And recently, there was a review that came in JAMA this year or last year. Yeah, that was this year. For the first time, we learned that one of the drivers of this high rate of maternal mortality in the US is mental health, perinatal mental health condition, pre-existing mental health condition, limitation to reproductive health care, as well as trauma and prenatal stress. So we partnered about 2 years ago. We partnered with a company called Behavior / now they changed their name. They are called Realize Care. This company already had on the market the Nurture VR. The Nurture VR is let me give you something. Can you hear? Okay. That means
Hope Memorial
we
Hospital
create the
in Fort Beach,
intervention.
California, is a leader in advancing patient care and experience. Partnering with Behavior, the leader in therapeutic VR programs for behavioral health, we would like to introduce you to our Nurture virtual reality program. We want to make this pregnancy and your postpartum period one of the best experiences in your life for you, your baby, and your family. Here's a preview of some of the program's content.
Okay. Yes, so this is the program that we are currently evaluating with the Nurturing Mom. It's still ongoing. I mean, the actual intervention is it's still ongoing. However, last year, so this was also a way for us to gather evidence, proof of concept for my keyword application. So after some of those research participants were exposed to the Nurture VR headset for 5 weeks. So we gathered about 10 mom who participated in Nurturing Mom. And so with the goal to, gather some preliminary data on and also gather feedback on the experience with motherhood stress, from a maternal perspective, as well as the experience with stress management, their perception or their definition of resilience, as well as experience using like virtual reality in general. As you can see, those preliminary data had already been published in April in Frontier. I also presented partial data at the SLEEP conference in June 2021. So here you have the focus group interview guide that we use to conduct the discussion with the women. And from a data analysis perspective, we adopted a general inductive approach. And here you have a summary of Nurturing Mom participant reported experiences. Again, as you can see, specific maternal stress. That means not everyone is experiencing the same stress level and has the same resources to cope with those cumulative stress. So we group maternal stress in this case into two main factor. The first one was the overwhelming caregiving responsibility, and also the fact that they had to juggle between the overwhelming caregiving responsibility as well as professional obligation. And we realized that, this overwhelming maternal stress constituted a huge barrier to their overall well-being. And we were also mindful of the fact that they were dealing at the same time with cultural factor. Remember, we were working with women of color, Black women, as well as Latina. So there was a huge pressure from their environment to suppress weakness, emotion. So they were in fear of appearing weak. They were under pressure to hide vulnerability, and not all of them had the same social support level, right? And we were mindful of the fact that their socioeconomic status were a huge deal in the stress level they were dealing with. So in terms of the solutions that we gathered, there was a list of stress management coping strategies they put in place, such as sometimes when they are feeling overwhelmed, they would go for a quick break. Some of them would read, some of them would ask for help from family member, including their husband or baby daddy. But some of them did mention that it wasn't that great. And in the context of the intervention, they also discuss how the Nurture VR provided educational information that were very life-saving with regard to, for example, breastfeeding, right? And also Nurture VR provided a sense of escapism to them. And here you have some direct quotes from those sessions. So when it comes to struggles in motherhood or mother-to-be, this is from mother of one. She said, one thing I struggle with is time management. I guess before it would be like, I can just get up and go anywhere. And now I barely have time to take care of myself. Now I'm looking for like a strong quote, because it's a lot, as you can see, it's a lot in terms of maternal mental health care. So there was a question, since I was one of the expert matter when the Zuranolone, which is a postpartum depression medication that got FDA approval last year, and like for the media at I was asked to provide comment and perspective on that. And one of my position was that it's good, it's a great start, but at the same time, we also need to address social determinant of health. So it was the occasion for me to test, to gather, perception of perinatal women on that medication. So one of the participants mentioned that the type of insurance that she has at the moment is just a discount, and they don't really cover specialists. So I do pay out of pocket for my psychiatrist. I would be interested in trying out the medication because I do feel that my postpartum is intense. But the thing is, she didn't even realize how expensive this medication would be. I remember last year, it was about, I was hearing 10,000. I don't know what kind of arrangement they have with the insurance right now, but unfortunately, that wasn't what she was thinking at all. Okay. With regard to nurturing mom experience, because not all 10 participants provided just beautiful they were honest, right? They learned. It was a moment for them to escape. but one mentioned that I need to be in the presence of a human being and I can't get that connection with any headset or device. Another one mentioned this touch to the on-demand aspect of the VR. You can do it at 12 p.m., you can do it at 12 a.m. It was just like, okay, I need to find at least 1 hour to sit down and have no distraction and do it. But again, once you start it and you start learning and going through the experience, it is a great experience. Okay, other participant mentioned that it has helped, but still doesn't help 100%. As a mom of 3, you're always trying to make sure everyone is happy and healthy, and with so many sicknesses. And one mentioned, at first, I didn't believe the VR headset could reduce my stress, but as I use it, it seems my worries go away. I sense my worries go away. I was enjoying my time with the VR headset and all the tools and resources provided. I would recommend this for stress management. Okay, in terms of, okay, so I have only 7 minutes left. Okay, so with regard to mental health, maternal mental health, we can say that virtual reality is becoming more and more a useful strategy to address maternal mental health crisis in the US. And one of the aspect that I think more and more we are gathering evidence for is the need for culturally tailored and affordable VR-based intervention, which has the potential to mitigate the barriers I mentioned in the beginning, such as social determinant of health stressors, and thereby contributing to the reduction of social determinant of health stresses among women and mothers of color. And with regard to future research, I recommend, or my goal is really to explore further the theme that the research participant from Nurturing Mom addressed during focus group, and we find digital intervention for perimenopause women of color. Okay, and to end the presentation, I wanted to also introduce you to the Realist Women Study project, which is being implemented at the University of Miami. My hope is that I'll be able to organize a huge community gathering next month in order to launch the project. So the goal of the Realist Women Study is to address chronic intersectional stress, namely including psychological resilience, sleep health, and blood pressure among Black women. And this will align with the NIMHD mission to promote minority health and reduce health disparities. With regard to innovation of the Realist Women clinical trial, is the fact that we are adopting an intersectionality framework to implement the project. We are using mixed method in the beginning, the first step of the project is to conduct a focus group as well as individual interviews to gather Black women perception experience with intersectional stress, as well as experience with VR-based stress reduction. And the goal of of the aim 1, the mixed method approach, or the qualitative step of the study is to gather evidence to develop culturally intervention to reduce intersectional stress among Black women. And a third innovation aspect of that project, the Realist Women project, is the use of virtual reality, immersive technology. And other innovative aspect of that project is the focus on multiple health outcomes, such as stress, resilience, sleep, and blood pressure. And of course, since it's a keyword career development project, the goal is to provide training and mentorship to me as the PI to become an independent investigator in the field of psychological resilience tool assessment, and also mind-body, culturally tailored mind-body intervention. So the intervention would look like this. First, participant would, after the focus group and the individual interview, I will enroll 60 participants in the project, and they will fill out a bunch of questionnaires on stress, intersectional stress. They will be provided with devices, wearable devices, to monitor their sleep as well as blood pressure at home. I will also gather information on anthropometric factor, and we will also monitor. There will be also EMA, ecological momentary assessment, and of course they will be compensated for each step. And then following baseline, it will be randomization within two groups. One group will be assigned to, like, some participant will be assigned to 30 will be assigned to the control group, receive AHA brochure and infographics, and then the intervention groups will receive the headset, the VR stress management program. And so for basically about 8 weeks, they will be exposed to that virtual reality program. We will also repeat the baseline during the intervention. And then within 3 months, we will repeat the baseline. And everything that I already mentioned at baseline, we will repeat that. And in terms of eligibility, in order for them to join that project, they need to be self-identified as Black women, at least 21 years old, be fluent in English, come with an ICD-10 diagnosis of hypertension, reside in South Florida, and willing to be audio recorded, and also complete the Superwoman Schema questionnaire. So with regard to our aims and also hypothesis, so the first hypothesis is that participants randomized to the intervention stress management will report a 12 and up reduction in the average mean of stress after the exposure to the VR-based stress reduction. Participants randomized to the intervention will also report an increase of 0.77 in resilience assessment. They will also report an average of 7 hours of sleep duration. And in terms of adherence to the intervention, we will observe 50 and up percent in percentage of their adherence to the intervention. So that's aim 2, which is to assess feasibility, acceptability, and patient satisfaction among the hypertensive women enrolled in the project. And then third aim, which is exploratory, so we will also observe among participants randomized to the intervention decrease in 24 hours blood pressure. Et voilà. Again, this is a project that I'm about to launch. That means I don't have yet results to share, but given that I am about to launch it, I will be recruiting. I'm on a mission to advertise the project. So if you know about any Black women with hypertension that would be interested in joining the project, please send them my way. And also, of course, I'm looking for collaborators, and I'm in the process of hiring a research associate. So your input and contribution are welcome. Again, as always, I would like to end the presentation with a call to you to join us on this journey, whether you're a scientist, a community member, a policymaker, or simply someone interested in the advancement of health and science. Your voice and your perspective are important. Together, we can continue to interlace this fabric of scientific and community collaboration, creating a future in which the benefits of research reach every corner of our community and beyond. Et voilà, thank you for your attention. Questions are welcome.
Wonderful, Dr. Blanc.